ready to do another talk again?
Yeah, but I get so anxious and nervous before I do these.
Wow, that really surprises me. I mean, you've given talks all over the place to
I,
lots
I,
and lots of people.
I
It
know,
shouldn't bother you at all.
but it does. I think it's ever since I was a kid. I have like stage fright.
Yeah.
Just even if there's no one there, it's just something that happens.
Yeah, of course, at least you know kind of why it is. There's lots and lots of people that don't really know why they have anxiety, right? I mean,
Yeah, that's true.
Isn't that something that
there's
patients that see you and you try to figure it out?
Exactly. There's like so many people out there, they've got anxiety. They don't know why they're having anxiety. They're trying to figure it out. At least I know. At least I know what's causing it.
Sure. Okay. So maybe we should do a talk kind of on anxiety and supplements and what you might do to help a patient through it. Would that be a good topic?
That's a good idea.
Oh, yeah, good.
All right, let's do that.
So you about ready to start? So
yeah.
Okay.
All right, click that thing.
Yeah. Okay. Good. Well, hello, friends out there, and we're back again on our prescriber spotlight with Dr. Keri Topouzian.
That's me.
And that's Dr. Topouzian. He's over on my left. There's nobody on my right. And so, the wall is there.
All right.
But anyways, we're going to talk today about anxiety. We just thought that would really be a good topic. Every so often, I mean, actually it's fairly often, and I have patients walk into the pharmacy and they'll just say, I don't want to take my medication. I don't want to take this drug anymore. It makes me feel strange. And is there any supplements that I can take? And so I'm sort of at a loss sometimes because there's a few things we can recommend, but a lot of times I want them to see a prescriber, another practitioner, and you, with your ability of doing functional medicine, that can dive into a whole different area. So what kind of things do you work on when you see a patient with anxiety?
Yeah, right. I mean, there are so many different things that can cause anxiety, and it's just, I mean, I'm having anxiety just thinking about it. I mean, I made up a list because I was worried I wasn't going to remember everything that causes anxiety. But just as a couple examples, hormone levels with women when they start getting in their 30s or 40s, they start losing progesterone. One of the symptoms is anxiety, panic attacks. With guys, they start having anxiety when their testosterone levels start going down, and that can be in they can start as early as in their 30s. Okay, sometimes in their 20s. Every once in a while, I'll check a guy's testosterone level, even though he's in his 20s, just to find out. Okay.
Cool.
Thyroid, there can be, if you have high or low thyroid, autoimmune thyroid, Hashimoto's, Graves' disease, those can cause anxiety.
Sure.
And there are certain drugs or prescriptions you might be taking. For example, if you're on omeprazole or Prilosec, which are those drugs for heartburn, GERD, what happens is when you take those medications, you lower your magnesium levels, your mineral levels, and you can have anxiety from having low magnesium levels. Okay. Wow. Another good one is cholesterol. If you're on any of the cholesterol lowering medications, so this is interesting. If your cholesterol levels can be too low. Okay, so if your levels are too low, you can have anxiety, depression, violent suicide. Okay, hopefully no one's thinking about that.
Wow.
But those are all studies that have been done by psychiatrists. I mean, you'll never hear about too low of a cholesterol.
Right.
Okay, but anything that's below 160, 150, you can have anxiety.
Well, we know that cholesterol, for example, is a really important molecule. I mean, we make so many different things in our body out of cholesterol. People just think that if their cholesterol is too high, that's bad. And if they take a cholesterol lowering agent, they don't realize that they can actually push their cholesterol too low. And nobody tests for too low a cholesterol.
I do.
They only test for too high. Okay.
I check all the time.
Functional medicine doctors do that, and Dr. Topouzian does. So that's great. So tell them how to get a hold of you. How do they come in and see you? Where are you at? How do they make appointments with you?
They can call the office 248-302-0473. They can check out our website, which is askdrt.weebly.com, which is a good site. Check it out. You can get a better idea of what some of the different things we do.
What if they're having anxiety about seeing Dr. T?
Well, then I would have them take a Epsom salts bath before they come in the office. Like
Very
the night
good.
before, maybe do a little yoga that morning,
Perfect.
Get outside, get some fresh air,
and
then come on in.
And then call you.
Yeah.
All right, sounds great. All right, friends. Hey, another successful talk with Dr. Keri Topouzian here from Mike Collins from Healthway Compounding Pharmacy. If you have any questions, feel free to give us a call. We're in Saginaw, Michigan. And thank you. Stay healthy, my friends.
Take care.